In the city of St. Louis alone, 723 cases positive. In St. Louis County, 1,850 cases positive. And in the state of Missouri, 4,700, I'm using round number, cases positive here. So what you see is that the city and the county have more than 50% of the cases in the state. And if you add St. Charles County to that, it pops up to close to 2/3. So very serious situation. You all know that. We have also, unfortunately, had 26 deaths in the city of St. Louis, 58 deaths in St. Louis County, and 133 in the state of Missouri. So as you can see, 78, 2/3 of the deaths from COVID-19 so far are in St. Louis City and County. So on the good news side of things, thank you all for staying at home, those of you who can, washing your hands and practicing social distancing. It is paying off a bit. Our number of cases, the trajectory is not as high as we feared that it might be, but it is still going up. We are flattening the curve a little. The latest models show us that, but we are not flattening the curve enough that we can risk going back to our old ways here and then risk having a really steep increase in the number of cases and the number of deaths, or we can't risk having this second wave, which you hear about this on the news all the time, but it's a reality for us as well. So that is the good news. Thank you all who are, they work for the water division. They work at grocery stores. All of those folks we know are still working. They're working very hard. We are doing our absolute best to be sure that everyone has PPE, personal protective equipment. We are ordering it constantly, getting it in constantly. Today, I happen to know that we got in 40,000 masks. So, and they're needed right now in our various departments. So, all that continues to go on. We have to provide PPE to folks, and we are doing so. Everybody is struggling with it, you know that, but it is starting to become a little bit more available, and we certainly want to make sure that everybody working has it. So that is on the thank you end of things. I do want to talk a little bit. I know that many of you have lost your jobs or your hours have been cut way back. We know that this is devastating for the economy. We have to put public health ahead of the economy, but both are devastating to us. So we are hoping that over the next month or so, we will see a rapid increase in the number of tests that become available. Both the diagnostic tests that we've been waiting on, and we're still waiting on, but also the serology tests, or the tests that see if you've already had, test to see if you've already had COVID-19 and therefore might not have it again and might be able to go back to some normal duties. But I feel maybe a lot like some of you do, which is that we've heard over and over again that we're going to get more and more tests. We've gotten a few more, we've gotten a little more, but we need testing in a major way in our major top-notch medical facilities and research facilities like we have right here in St. Louis between Washington University and St. Louis University. So that is still a bit of an unknown, but I am feeling a little bit optimistic that this testing will improve and become more available over the next few weeks. And it's really based on what our medical experts are telling us. We are still in very frequent contact with the heads of SSM, Mercy, and BJC to try to make sure that we're making decisions that are in sync with one another. I have said this before, and I'll say it again today. Our stay-at-home order is scheduled to end on April 22nd. I can say with confidence that it is not going to end on April 22nd. We are going to have to extend this stay-at-home order based on the science, based on the data. We don't know how long we're going to extend it for yet. I think you can expect a decision about that in the next couple of days here. St. Louis City and County are working together on that decision so that one of us doesn't give you one date and that somebody else gives you a different date. But we will be extending the stay-at-home order, and we're working on the date. We're doing this because the public health risk is really too great to lift the stay-at-home order at this point in time. So talk for a minute about homelessness. Some of you know this, it's been in the paper. The city of St. Louis has added about 202 or 204, I think is the exact number right now, of homeless beds to what we normally have. And those are coming on. 100 are already online, another 100 are coming online literally today, tomorrow, Friday, Monday, as we get operators under contract to operate some of those facilities and as we operate a couple of them ourselves. So we are working very hard on that to be sure that our unhoused population does have a roof over each. Workers visited with every individual who is in the downtown encampment and several other locations around the city. There were a few people yesterday who agreed that they would like to go into housing. We are working with them right now to get them into an appropriate location for them. Right now, or at least at 1 o'clock today, our outreach workers were again at the encampment trying to engage with people and get them what they need in order to be able to go into shelter. That is a major focus. We simply have to take care of the most vulnerable of our population. We can't do it alone. We're doing it with partners. We appreciate those partnerships very much, and we all just have to work together on that. And we're optimistic at this time that we are making progress because we do have beds that are available at this time. So last item on my list is our budget. And, you know, the city's budget, our budget depends on what level of services we're going to be able to provide going forward. We've got the 3 months that we're in this year, April, May, and June, and then we're working on next year's budget. We know that we are taking a big reduction in revenue, in sales tax revenue and in earnings tax revenue, tens of millions of dollars in both of those time periods. We also have some funding that is being provided by the federal government that can cover some of those costs. So right now we're working with our own staff and working with professionals in the comptroller's office, in the budget office. We've out now in the healthcare field, and that have been in existence for decades, but they certainly are exacerbated now. We do know, and many of you have been asking if we have race data. Yeah, we released a week ago, maybe 10 days ago, we released the data for positive cases by age, and by gender. And at that point in time, because we had a lot of positive results from private labs that had not indicated race, we didn't have all the race data. Today, we have most of that. We will be releasing that this afternoon or tomorrow as soon as we get it in a good enough format to release it to you. But one of the things we do know, the takeaways, is that of the positive cases in St. Louis, and Dr. Eccles told me this last night late, of the positive cases in St. Louis, 71% of those cases are African Americans. We also know that all but 4 or 5 of the deaths that we have had in St. Louis, and we've had 26 deaths, so the majority of those deaths are also among African Americans. So very serious situation, and it is one of the factors that we have to take into account as we figure out how to spend this federal money going forward. I think I've covered all the topics that were on my list for today, but if you have questions, I'm happy to take them. Jacob, do we have any questions?
We have lots of questions
today. Lots of
Mayor.
questions. Okay.
So on the issue of the disproportionate impact on African Americans by COVID-19, what is the city going to do in the short term to provide resources to those communities that are being hardest hit by this virus?
So thank you for that question. It's a good question. So there are several things. One, with our partners at the Missouri Foundation for Health, we are doing outreach, door-to-door outreach. It began last weekend, actually, to neighborhoods that we feel may not be getting the message in other ways, just to let them know how important this is, that people stay at home, that you wash your hands, number one. Number two, we have 4 testing sites in, 5 testing sites now in the city of St. Louis. We have the site, it's a BJC site right in the heart of the city at Clayton Avenue and Boyle. That's right by the Cortex Metrolink station. We have a site at 1717 Biddle. That's an Affinia site. We have a site at 5471 Martin Luther King. That's an STL Care STL Health site. We have a site on Page. It's actually just a hair outside the city limits. It's in Page Dale. That what we arranged for this site at 6763 Page. And we also have a site on South Broadway, Affinia on South Broadway, and I'm sorry, I'm looking, I don't have that exact address. That's near Broadway and Jefferson in South St. Louis. And we have a site on Whittier, which right now is closed for a bit because they had some positive cases among their staff. So, this hits everyone, every place. So those are some of the things that we're doing in the short run, which is what you ask about. Of course, we have to focus on the long run as well. But for right now, for today, in the short run, making sure that people get tested and then get the health care that they need.
So lots of questions today, Mayor, about the stay-at-home order, which is set to expire 1 week from today here in the city. You said a little bit ago, you have no doubt that we will extend it. Some people who have either been furloughed or laid off want to know, how can you justify that decision when so many people are hurting economically and you're asking them to go even longer without pay?
That is really the crux of this decision. And it is, to prevent people from getting this very serious virus, a virus that is killing people, we are devastating our business community and, most importantly, the folks who work for those businesses that are laid off. Now, I would say this. 1, apply for unemployment. If you've been furloughed or laid off, you must apply for. That's what it's there for. Employers pay for that throughout the year, year in and year out. And so they've paid for that unemployment insurance insurance, which is a federal government and a state government program, but that is that's the best thing to do right now. Many people just in the last day or two have gotten the $1,200 from the federal government, from the Families First Act. If you haven't gotten it yet, you should be getting it soon. How quickly you get it depends upon whether you provided your bank account information to the federal government when you filed your tax return, either this year or last year, 2018 or 2019. If you didn't provide that information, then they will be sending you a check. Checks take longer, obviously, than direct deposit. So those are a couple of things that are some